the role of health visitors in identifying signs of neurofibromatosis type 1. Hello, my name is Dr. Carly Jim. I'm a senior lecturer at Manchester Metropolitan University, and I'm also one of the trustees of the charity the Childhood Tumour Trust. Together, we have a joint campaign to improve earlier diagnosis of neurofibromatosis type 1, or NF1 as it's known for short. We strongly believe that health visitors have a crucial role to play in the earlier diagnosis of NF1. So, what is NF1? Well, NF1 is a genetic condition, and it's a relatively common genetic condition. It has an estimated birth incidence of 1 in 1,700 and a prevalence of 1 in 2,500. Despite the fact that it's a relatively common genetic condition, it's still a condition that not many people have heard of. So just to give you a little bit more background about what neurofibromatosis is, essentially it's a tumour-prone condition, and it's associated with the risk of developing a number of different complications. Now, it's a highly variable condition, which means that not everybody will get these complications. Some people may have no complications at all, and other people may have extreme complications as a result of the condition. So because of this, it's incredibly important that people have the right diagnosis and that they have the right surveillance in order to identify if there are going to be any problems. So, in terms of the list of some of the possible complications, you can see that it covers a whole range of different conditions. So, in addition to the tumours that are characteristic of neurofibromatosis, there can also be bone deformities, sight problems, mobility issues, cancer, in particular things like optic glioma, and later on into adulthood, looking at things like peripheral nerve sheath tumours. Also, learning difficulties, social skill difficulties, for example, the autistic spectrum disorder, attention and impulsivity, coordination difficulties, and also it's quite common for people with this condition to have a form of disfigurement. Now, if you look in the media, some of these forms of disfigurement may be quite severe. This is generally not the case for the majority of people with neurofibromatosis, but the characteristic cutaneous fibromas of neurofibromatosis, which are the small spotlight fibromas, are considered by many people to have a cosmetic difference to them. And this is something that people have varying degrees of comfort in terms of the impact they have on their looks. So, I consider neurofibromatosis to be a condition which increases the risk of other conditions, and therefore its early diagnosis is absolutely crucial. So, despite how common NF1 is, and despite how many other conditions it impacts on, the extremely worrying thing is that many people have never heard of it. And that's not just people in the general population, it's actually people within the health profession. So, for example, GPs, midwives, paediatricians, and even health business have little awareness of NF1. The consequence of this is that misdiagnosis, and in particular delayed diagnosis, is really common. And at MMU and at the Childhood Tumour Trust, we really want to change this. And we believe that this is something that health visitors can play a crucial role in. So, as people with NF1 could potentially develop these varied complications, really what we're pushing at the Childhood Tumour Trust is this early diagnosis leading to appropriate surveillance. And there's another part to this as well, and that is, as NF1 is a genetic condition, it's important for the individual to be able to make informed reproductive decisions, because without being able to make these decisions, there is a 50-50 transition rate of NF1. And because it's a variable condition, there's a chance that the offspring may actually be more severely affected. Now, obviously, making reproductive decisions is very individual. However, the important thing is having the information to be able to make that decision. And in many cases, people are being diagnosed after they already have children, often as a consequence of their child being diagnosed, and then retrospectively them being diagnosed when you trace back the genetic lineage. And that's something we really want to change. So how can the health visitors help? One thing you might be asking yourself is, how can we pick up what NF1 is? Well, one of the most frustrating things that we feel about this misdiagnosis is actually the key feature of NF1 is really rather obvious. In fact, it's so obvious, it's just a flat brown birthmark. The problem with this is that birthmarks in NF1 are a particular type of birthmark called a café au lait. But birthmarks in general are so common that you wouldn't automatically flag a child up just because they have some birthmarks. And actually, so as not to worry people, having one or two birthmarks isn't going to be indicative of NF1. Having one or two birthmarks is something that about 10% of the population have. So the key issue here isn't just having the café au lait, but it's their quantity. And this is where it becomes really crucial, because 95% of children with more than 6 café au lait that are greater than 0.5 centimetres will in fact have NF1. And that's a shockingly high statistic when you consider the misdiagnosis. So just to give you a little bit of a look, these are some pictures of café au lait marks. You can see that they are all indeed flat brown birthmarks, but they're not necessarily all identical. Some of them are larger than others, some of them are darker than others, and obviously it's impacted as well in terms of skin tone. They're also in different locations on the body, although typically more numerous on the torso. So this just gives you some idea as to what the café au lait marks look like. A few more café au lait marks coming in. So you can get a real sense that there is nothing particularly tricky about the identification of these birthmarks. So you may still be wondering, yes, but what if I'm not qualified to pick this up? And I want to stress to you that we're not suggesting that health visitors make the diagnosis. What we're suggesting is that health visitors make the accurate diagnosis of the café au lait in as much as they can make the referral to a genetic specialist who can confirm whether or not it is indeed NF1. And it's important as well, because if it is not NF1, it might be nothing sinister, or it may even actually identify a different genetic condition. So really, the take-home message is this. If you can count to more than 6, and if you can distinguish brown from other colours, then you are capable of recognising one of the key diagnostic features of NF1. And really, that is so simple that even a child could do it. And from the point of view of NHS funding, it's not invasive and you don't need expensive tests. Also, if you can go one step further and have a dialogue with the parents and you can ascertain if either of the parents have café au lait marks, then actually you've covered 2 of the diagnostic criteria. And then NF1 is almost certainly going to be confirmed by the specialist. So as a house visitor, you're in a really important position, because very often there's opportunities where you see the child fully undressed. So, for example, at a baby weigh clinic. And this allows for the visual assessment. But even if you don't have a visual assessment, maybe with a slightly older child or because you're doing a routine visit for something else, you can still open that dialogue and you can still ask the parents, does the child have any brown birthmarks? And if they do, roughly how many? And if you get a confirmation of that, then you can ask a further question, do you or their other parent have any birthmarks? So we really do think that health visitors have a massively crucial role here. And it's not just within your own patient sample then about getting that referral that's so crucial. It's also about helping us and supporting us with our campaign. So if you can, please share our posters. And please also support our campaign for the logging of café au lait in the Child Health Record. And this is something in particular that Vanessa Martin, our chair of the Child to Tumour Trust, has been campaigning for a couple of years now. And we really want this to get in, because just a simple line that asks about the skin could potentially make a massive difference to the diagnosis of this condition. So just to give you a little bit of a look at the Count the Cows poster, so you can see that it basically says the same information that I've just been saying. It just talks about what the cafe au lait are, gives you a couple of pictures, and then the crux of the issue is count the cows and refer to genetics if you suspect NF1. So if you want more information on the Childhood Tumour Trust and our campaigns, then please do visit our website and also visit our public Facebook page. I hope that you found that interesting, and we certainly look forward to working closely with health visitors in the future in what we think is a key area and one that you really do have an important role to play in. Thank you very much for your time.